More than 3 million people a year suffer from migraines, according to the Mayo Clinic. If you've ever had one, you know it's not just a bad headache. It's much worse than that. It can have very complicated triggers. Here with insight from the Center for Healing Neurology is headache specialist Dr. Shireen Issa and physician assistant and assistant medical director Deirdre Gately. Welcome to both of you.
Thank you.
Tell me a little bit about these sorts of headaches, because I think people kind of think, oh, it's like when you haven't eaten after lunch and you just take an aspirin and you're okay. No.
Right. So let me start off by saying that any pain anywhere in the head is considered to be a headache. But I have to emphasize that no headache should ever be considered to be normal. Now, in this broad category of headache disorders, migraine is by far the most common type. It is the third most prevalent disorder and one of the top 10 causes of disability worldwide.
Isn't that something?
Yeah.
And women get this more than men, correct?
Yes, they do. They get this 3 times more than men, and they're usually women of childbearing age.
Isn't that interesting? How long do these things tend to last over the course of a lifetime?
That's a really good question.
Because I'm waiting for mine to stop.
Yeah. Well, there's hope. Usually after menopause, you'll see a decline in the severity and the frequency, and sometimes they'll resolve completely. So it varies.
To menopause. Okay.
Yeah.
Yeah, not that I'm not by that, just thinking that's a long time to wait. How do people recognize a migraine? For example, kids can have them, teenagers can have them. What should parents or people know about how to recognize them?
Right. So most people think of migraine as a severe, one-sided throbbing pain, but there's really much more to it. It can actually have 4 distinct phases. In the first phase, which can actually occur hours to a week before a migraine pain hits, most migraineurs, including kids, can feel unusually tired, may have neck stiffness, may yawn frequently, and may have mood or appetite changes. Now in phase 2, which is called the aura phase, and this is only present in 20 to 30% of migraineurs. This is where they can see flashing lights, may have face or arm numbness, or may even have difficulty speaking. And this heralds that the pain is going to come on within minutes. So both phase 1 and phase 2 are biological cues that a migraine may occur. Phase 3 is the pain phase, where you feel the one-sided severe throbbing pain associated with nausea, vomiting, and extreme sensitivity to light and sound.
That's I'm just staying still under the blanket here for however long.
Yes, that's where they get into the quiet, dark room, and this can last for up to 72 hours, followed by the last phase, where the migraineur is completely exhausted and can return to function. You asked about kids.
Sorry,
so you asked about kids. So in terms of children manifesting migraine, they may not manifest it as a one-sided headache, and the presentation can be more bilateral and more of an ache, but as they grow up and go through puberty, and they might manifest it more classically.
It can also manifest as abdominal pain.
Really?
Yeah.
Yes.
So children often present with abdominal pain. Cyclic abdominal pain is a common presentation for migraine in children.
Really? Even if they don't have a headache at all?
That's correct, yeah.
So how do you treat that?
Well, actually, you use some of the same medications, but obviously they're appropriate for children. Right. So an antihistamine called cyproheptadine is very commonly used.
Isn't that something? I had honestly never heard that as many times as we've discussed migraine.
Yeah.
So things are more treatable these days.
Yeah.
Tell me about developments in treatment, and then just quickly, is it curable? Can you do anything about this on a permanent basis?
Right. So I'll give you a short response. I always tell my patients that migraine triggers can be identified and avoided, migraines can be prevented, and pain should be treated right away. So migraines are considered an inherited disorder. So like most other genetic diseases, there's no cure, but we can really effectively manage them.
Right.
And this is exactly what we do at our center, where our whole goal is to put patients back in control of their headaches in their lives and not the other way around.
And so how do you do that?
Right. So I'll let Deirdre address the trigger part of it.
Yeah.
Well, and there's some common ones, you know, red wines and aged cheeses.
Right.
And people know what their triggers are, or eventually figure them out.
Sure. But that's an important place to start, Margaret, with the foundations of health. So what are you putting in your body? Because we can choose to put food in our body that's going to increase our inflammatory load, or we can put food in our body that's actually going to quell or combat that inflammatory load. So looking at people's dietary habits and helping them find modifications is one great approach. Making sure hydration is really an incredible part of migraine prevention, because dehydration, skipped meals, these are common triggers. Sleep disruption. Especially with the busy lifestyle we're all leading, we're trying to get everything done within the small time frame that we have each and every day, and people aren't getting enough sleep and they're not getting restorative sleep. So focusing on sleep hygiene, because insufficient sleep is another trigger.
Exactly.
Stress management. At our clinic, we offer acupuncture services, we offer guidance in meditation, we do dietary modifications as I recommended. We offer, in addition...
Although, can I interrupt there just for a second?
Sure.
Because I do know that people will say about people who have migraines, oh, you're just stressed out or kind of delicate around stress, and that's not what we're talking about here, right?
No, well, it's yes and no, right? I mean, stress is a common trigger.
For migraines, but it doesn't make somebody you know, less tough or
But it's
less...
not the cause of the
it's not the cause
of migraine, I guess,
No.
is what that was once kind of a, I think, a thing that happened with women.
Yeah, exactly. Right, the myth buster, right?
Yes.
That you're in some way not as
house
hardy.
flower. Yeah,
Yes, exactly. No. I mean, look at us, right?
Right.
We're certainly hardy women, right?
Exactly.
And yeah, so...
So when is it time to see a specialist? Just very quickly. We'll have more time to talk a little bit later.
Sure. So there's really no right or wrong time. At our center, we see any patient who's suffering from headaches who hasn't gotten relief from their current treatment regimen, but in particular those who may be interested in an integrative and holistic approach to their headaches. In particular, I find this really useful in the subset of patients who cannot take medications, such as women who are pregnant or breastfeeding, because they really are limited from so many oral medications.
That's very good. Yeah. That's an important point. To schedule an appointment or learn more about the services at Center for Healing Neurology, please visit the website on your screen or a link on New Day's website that's already up. Thank you very much. We'll see you soon.